No, in fact, the guidelines as they're written now, there's two guidelines. One was put out by the NIAID in 2010, and the other one was from the Joint Task Force for Practice Parameters that's put out by the Academy and the college. And both of them say currently that immunotherapy is not recommended in the treatment of patients. That's what they currently say. So there's a bit of a disconnect there with where the field is right now in 2019. And a lot of people are talking about, what should should there be revision of those guidelines? Should there be issuance of new or different guidelines? What, if so, what should be in them? And I don't think there's a sort of a unified feeling about that right now. My perspective is that, again, with the Palisade data set, you now have by far the largest clinical trial in food immunotherapy. So you have the most robust set of data on which you can you can make evidence-based recommendations for peanut because of the strength of the study, and that you had 550 individuals in 10 countries, 66 sites, randomized, placebo-controlled, like really rigorous study. You don't have that for the other foods. And I think this idea that, well, we've worked it out for peanut, so we now can apply those lessons to other foods is I think a worrisome conclusion, because my feeling is that there's ample evidence that other foods behave differently. The natural history of the diseases is different. There are multiple sort of patient phenotypes that are different with, say, milk, and so there's some preliminary data from milk OIT studies that looks very different than peanut. And so I would like us as a field to continue to evolve in an evidence-based direction, where we actually study these concepts with rigorous protocols and, adapt our practices accordingly. And there seems to be sort of this kind of rush to move forward and treat patients, even despite the fact that we don't really know yet what we're doing, what dose is right, what regimen is right. We're kind of off the map for a lot of these other foods. And that as a scientist, that just sort of concerns me. And as a person who takes care of these patients, we know that they are dealing with a high unmet need condition. We know that they are desperate for solutions. I see those patients in my clinic, and they're hungry for something better than what they have. That's why I do this kind of work. But that does not mean that we should do something without really understanding what it is.